Hello viewers, welcome to the Learners Nursing classes. Today we will be dealing with the topic nutrition and multiple choice question based on this topic. So let us start. Which of the following is a full fluid diet? The options are milkshakes, fruit juices, beverages and clear vegetable and dal soup. So here the answer is milkshakes. Which of the following nutrient cannot be completely supplemented by diet in pregnancy? The options are calcium, iron, zinc, phosphorus. The spelling of zinc is this. The answer is iron. Dalia, khichdi, suji kheer, upma, custard, etc. have the consistency of full fluid diet, soft diet, semi-solid diet, or the option is both B and C. So here the answer is both B and C. Answer is option D. The recommended level of fluoride in the drinking water is 0.5 to 0.8 milligram per liter, 0.8 to 1.2 milligram per liter, 0.1 to 0.5 milligram per liter, and 1.2 to 2.5 milligram per liter. Here the answer is 0.5 to 0.8 milligram per liter. Excess of fluoride in the diet in the drinking water may cause fluoridosis, and that is why the acceptable level of fluoride should be 0.5 to 0.8 milligram per liter. To prevent anemia in pregnancy, iron supplementation should be started from the first month, the third month, the sixth month, or immediately after conception. So here the answer is after third month of pregnancy. That means from the second trimester. The following diet is recommended for viral hepatitis, jaundice and chronic renal failure. High protein diet, high fat diet, low protein diet, low calorie diet. See, the answer is low protein diet. The following diet is recommended for liver and gallbladder diseases. Low protein diet, high calorie diet, high fat diet, low fat diet. See, answer is low fat diet. Low calorie diet is given in the following diseases: protein energy malnutrition, tuberculosis, hepatic coma, increased metabolism. See, hepatic coma. We give low calorie diet in hepatic coma. Which type of diet is recommended for a client with cardiovascular disease and obesity? High protein diet, high calorie diet, high fat diet, or a low fat diet? See, the answer is low fat diet. BMI of an obese person is 35. He is normal, overweight, grade 1st obesity, 2nd grade obesity. See, 2nd grade obesity. BMI means body mass index. The following food should not be avoided in obesity: high fat foods, high carbohydrate foods, high protein foods, carbonated and malted beverages. See, the answer is high protein foods should not be avoided. The following food is not to be avoided in chronic renal failure: see, almonds, peanut, cashew nut, walnut, meat, poultry, fish, extra pulses, ghee, oil, sugar and potatoes. The answer is ghee, oil, sugar and potatoes. Which of the following is the objective of diet therapy or a therapeutic diet? To maintain adequate nutritional status of the patient, to rectify the nutrient deficiency state, to provide rest to the body, and all of these. So here the answer is all of these. Which of the following is the objective of diet therapy or a therapeutic diet? Sorry, this question is repeated. Bland diet is prescribed for the person suffering from peptic ulcers, gastritis, ulcerative colitis, all. See, these all are inflammatory disorders, and ulcers means अंदर पेट में घाव हो गए हैं, gastritis inflammation होता है, ulcerative colitis means colon का inflammation होता है. तो here the bland diet is prescribed in all of the above. Which of the following has highest energy value? Carbohydrates, protein, starch, fats. See, the highest energy value is in fats. The following nutrient is required in increased amount by girls 10 to 12 years as compared to boys of the same age: Protein, iron, calcium, vitamin C. Here the answer is iron. Which of the following vitamin prevent neural tube defects in the fetus? So vitamin B12, vitamin K, folic acid and pantothenic acid. Answer is folic acid. The following is not the common problem of adolescent: anemia, anorexia nervosa, obesity and underweight, the cancer. Cancer is not the common problem of the adolescent. How much percent of fluid is found in an infant's body? 40%, 60%, 80% or 50%. See, the amount of fluid found in the infant body is 80%. Which of the following nutrient is required in increased amount by boys of 10 to 12 years as compared to the girls of the same age group? Calcium, protein, iron, vitamin A. Here the answer is protein. Inadequate intake of food during pregnancy may cause premature birth, low birth weight babies, intrauterine growth retardation, or all above. So inadequate food intake in pregnancy may cause all above, that is premature birth, low birth weight babies, intrauterine growth retardation. So the answer is all above. The requirement of following nutrient does not increase the amount of work in both the sex, means in both the genders: niacin, thiamine, riboflavin, folic acid. So folic acid is the answer. The requirement of the folic acid nutrient does not increase the amount of work by the gender. Energy requirement during infancy, first year of life. Infancy means first year of life is about 200 kilocalorie per kg of the body, 110 kilocalorie per kg of the body weight, 80 kilocalorie per kg of the body weight, 50 kilocalorie per kg of the body weight. Here the answer is in infancy 110 kilocalorie per kg body weight of the calorie is the requirement. Breastfeeding should be initiated as soon as possible after normal delivery within an hour, within half an hour, 2 hour, 2.5 hour. So here the answer is within half an hour. After cesarean, breastfeeding should be started within half an hour, 2 hour, 4 hour, soon after birth on the table itself. See, earlier in the books it was written within 4 hours of cesarean, but these days the recent recommendation is as soon as the baby is born and baby is active, the breastfeed can be initiated on the operating table during the surgery itself. The following is true about breast milk. It provides almost all the nutrients to the infants to meet his requirement. It has anti-infective properties, it has anti-allergic properties, and all above are true. So here about the breast milk, all these statements are true. Man whose body mass index, that is BMI, is 22. He is overweight, underweight, normal or obese. So he is normal. Breastfeeding should be continued with semi-solids and solid up to 1.5 years of age, 6 months of age, 3 years of age and 5 years of age. See, here the question is up to what time the breastfeeding should be continued with the semi-solid and the solid food. So here the answer is 1.5 years of the age. But the process of giving solid and semi-solid food with the breastfeeding is called as complementary feeding, which is started at the age of 6 months, and that is called as complementary feeding, which was earlier used to be called as weaning. But here the question is breastfeeding should be continued with the solid and the semi-solid up to breastfeed कब तक देना है, तो 1.5 year एज तक बच्चे को आप कॉम्प्लीमेंट्री फूड के साथ ब्रेस्ट फीडिंग कंटिन्यू कर सकते हो. आफ्टर 1.5 year of age you can stop the breastfeeding. Cooking of food by dry heat is known as roasting, steaming, baking, grilling. Here the answer is baking. when we like we bake the cakes, so it is that process of cooking is called as cooking by dry heat, so that is called as baking. Thank you viewers, like, subscribe and share.